very, very excited to present today's webinar where we're going to focus on a really critical area, and that's how to demonstrate workforce capability in your upcoming audit. So we know that under the new standards, particularly Standard 2, it's no longer enough to just have policies in place. We need to be showing that we're actively planning, supporting, reviewing, and enabling our workforce in really quite a structured way. So we're here today to help break down that. We've got some practical experience, some tools, some examples, and lots that we know you'll be able to take away and use. It is my absolute pleasure to introduce today's presence. Their presence is a present to you. But today's presenters, we have Dr. Karen Patterson, who is AusMed's inaugural Chief Nursing Officer. She leads our clinical governance and workforce capability strategies and really does have such a distinguished career in health, leadership, governance, and workforce capability. And she brings that experience with you today and has some real gold nuggets to share with us. I've also got Robbie Rosso. He's our Chief Product Officer at AusMed. Before he joined AusMed, he founded Cadmus, which is an online assessment platform used by universities across Australia, the UK, and USA. And hopefully I'm a familiar face for most of you. My name is Zoe Yule. I'm an intensive care nurse, but my role now is Head of Community at AusMed. I've worked internationally on setting the scope and standards for practice for a role called the Nursing Professional Development Practitioner, or for many of you, what we know as L&D. And I lead AusMed's accredited provider unit, which is accredited with distinction with the ANCC and has been for over 13 consecutive years. So that's our introductions out of the way. I'm really excited to share today's agenda. It is a big topic, but what we're going to try and do today is start by setting the scene. And I'm going to introduce the concept of what is the minimum standard versus that gold standard or best practice standard that we can aspire to. We will then explore the types of evidence that auditors are likely or can request using the audit readiness tool. And then they are two new elements in the standard: psychological safety and trauma-informed care, terms or concepts, as I know many of you will already be familiar with. I like to think of them as key enablers. So we're going to introduce them with a big caveat that they are massive topics. They're webinars or conferences, study days in itself, but just shine a light on them through the lens of workforce capability today. And then Karen will finish off the presentation by looking at, really a strategic approach to capability building. And I know you'll get a lot out of her section. There's a lot to do, so let's get started. Okay, many of you know that, July 1 is coming. We've been waiting for this date for a long time. And I really acknowledge that it can feel overwhelming. Today's focus is Standard 2, specifically Outcomes 2.8 Workforce Planning and 2.9 Human Resource Management. They are huge. And I want to acknowledge that the good news is most of you are already doing this. Our goal is to identify what you're already doing, link them to some evidence items, and then think about building this long-term impact. These outcomes really go, beyond just having policies and procedures. They're asking a lot. And we do start by acknowledging you are being asked to do a significant amount of work for your organizations right now. Standard 2 within the strengthened standards is asking us to show something significant. How are we building a capable workforce? How are we reviewing performance? Are we linking that to development? How are we engaging with our workforce in a safe and structured way? There is a lot within that. We're talking about people. How do we support people? And for many of you, very, very large numbers of people. So the way that we can think of this, I draw on Amazon's bar raising, the concept of a bar raiser. See July 1, if you can, not as a daunting task, but as an opportunity. Meeting and implementing these new standards really are a bar raising activity. They give us an opportunity to look at what we're doing, but also to assess where could we go. Now, there's no one way to do this, right? So I think looking and beginning with standard 2 is a good place to stop and reflect that, yes, these are standards. They are meant to be standardized, right? But there is no one way to do this. And that's both our challenge and our opportunity, particularly when we talk about something like workforce capability. This more than any other area must reflect your organization's context, your risk, and most importantly, your values, what you want the fabric of your organization to be. So whilst we'll give you some high level concepts and some models and ways that you can show this, you can't match what someone else is doing. We can draw on and be inspired and enabled by others, but really when we're looking at how do we meet standard 2, it's about showing what works for you. I also want to acknowledge that I think currently, there is a bit of tension, and this is normal, between what do I have to do versus what do I want to do? And, what can I do between now and July? For many of you, the immediate goal may be very clear, and that is get across the line, get to July 1, and that's okay. We acknowledge that reality. I think, let's be honest, sometimes, doing the minimum may feel like that's all that we can do and that's all that we can manage. Okay. I think, you would all agree these strengthened standards are demanding. They are demanding so much from all of our time, all of our resources, and many of you feel that they are stretched. But do think of them as the minimum, all right? Do think of them that this is the minimum about what we can do. But let's also remember that there is a gold standard. And that gold standard is about building a thriving, a capable workforce. But that's the long game. It may not be achievable to do that right now before July 1. But this is your invitation. This moment, this opportunity right now is the chance to think bigger. We can't do everything at once, but we can hold a vision. We can identify what's that place for our organization. Where do we want to go? And that's what we're here to do, all right? We're here at AusMed to help partner with you and to take those small steps over time towards that goal. One step at a time, one day at a time, but we can get to that gold standard, that best practice when it comes to what we want for our organizations. And you're leading that journey to this destination. All right, I will pause. I hope that has, set the scene. It's a massive conversation, and I want to frame today's discussion with that, but also acknowledge that we know it is helpful and important to also look at this through the evidence lens. Reviewing what are those auditable items. We want to still provide clarity about what auditors might look for, what they can request in audits from July onwards. So I'll give it a quick overview of the audit expectations from Standard 2, particularly 2.8 and 2.9. But for any of you that hasn't already got yourself a copy, we'll pop the link in the chat to AusMed's Audit Readiness Tool. This has been, I honestly think, obviously I'm biased, but a game changer. We've had so many people request and really give such positive feedback about this tool as being helpful. So what it is, for those of you that may not be aware or have used it, it's a tool to identify, what evidence items might be requested during an audit, and they're taken directly from the Commission's audit tool. So the evidence mapping framework, we've taken, I think I can't remember how many 100 PDF pages and popped it into a really helpful spreadsheet. So really encourage you, if you haven't got a copy, to request that. For those of you that are familiar with it though, you'll know that audit items can sit across 5 categories. So we have documents and records, governing body feedback, management feedback, individual feedback, and by individual I mean what was previously known as the resident, your client or consumer. In the new standards, that term is an individual now, and observation and care outcomes. So we're now just going to go through each of these 5 evidence categories and pick out some of these key evidence items that relate to workforce capability and standard 2. Okay, so starting with documents and records, what might be asked of you during your audit relating to workforce capability? As you can see on our lovely clipboard here, we have your workforce strategy. We have risk mitigation and psychological safety strategies, which we'll come to. Worker supervision policies, performance review processes. We're going to introduce you to AusMed Perform shortly and look at how you can streamline some of that. Induction and training processes, your training matrix. For anyone that didn't attend or catch the recording, our last webinar looked at this in significant detail. I'm not spending much time, if any, today talking about training. We're looking at what else is there around workforce capability, and it is much more than just training or education. But catch our previous webinar if you want to double click on that a little bit more. Evidence of system improvements and even samples of worker performance reviews. So I guess think about, from documents and records, what have you got on paper? What's structured? How is it structured, and is it being updated regularly? Because I know many of you will have these documents in place. Today's webinar isn't to tell you this is what you need to have. I recognise that you have many of these items already. When it comes to governing body feedback, this is critical. Now, this is your board. Auditors will and absolutely can ask, how is your board involved? They will ask them directly in workforce planning. How does your board know if your strategy is working? How are they overseeing and assuring quality processes when it comes to recruitment, training, and supervision systems? So they will also ask your governing body, for examples, what are recent strategies that you've implemented and how effective were they? So a really, really, really critical thing is to make sure your governing body understands when it comes to workforce capability that there are some big substantial questions that can be asked during an audit of them. When it comes to management feedback, I think, this really, that the items of evidence here talk to, how are you managing that day-to-day reality, from planning your workforce mix, your skill mix, responding to shortages, looking at how decisions are made around training, and most critically, linking that feedback or complaints or whatever input it is to an action. But management feedback, that's you guys, and that's one of the most substantial areas for evidence across all of the evidence themes, but particularly when it comes to workforce capability. I recognise I'm moving through pretty quickly, but as I said, the audit readiness tool does go through each of these really, really clearly, and we've got some toolbox resources we'll show at the end that have picked apart some of these things, like a workforce strategy. How do you create one? How do you do workforce planning? We've got some great resources on that. So using this section to run through fairly quickly. When it comes to individual feedback, auditors want to hear directly from your staff, and especially agency and subcontractors. They want to understand whether they feel supported, whether they feel trained, do they feel safe, both physically and psychologically, to provide the best quality care. They can ask individuals, so our previously known as residents or clients, do they think that individuals are well trained? Do they know where to get help? Do they feel psychologically safe? And do they feel that there's enough skilled colleagues on a shift? And lastly, observations and care outcomes, really round out that picture. And that's, do the observations in the environment support what you've said, what your governing body says, what your policies and procedures say, and do they actually show in your mandatory quality outcome data that you're doing a great job? And that's where there's an opportunity to look at, percentage of staff turnover. They'll look at that and see, are people getting the care that they want? Is there enough staff, and are we doing that? So the way that we can think about this is a concept called triangulation. So, workforce capability shows up in so many different places. It's tangible, but it's conceptual at the same time, right? It can show up, as we've heard, in people's experiences, both the individuals providing and receiving care, and it can show up in leadership. It touches everything. So how do we show that in an audit that we're actually doing it? And this concept of triangulation is a way to start thinking about that. Michelle mentioned it in last webinar, in our last webinar, and I guess the way that triangulation is coming up in audits and the way that you can demonstrate workforce capability is connecting the dots. It's understanding that, as I said at the start, you're already doing so many of these different pieces. These items that can be audited, you're already doing. The task that I'd encourage you to focus on is to think, how do we link them clearly? How do we prepare our organization, from your executives to your individuals that are receiving care and to the workforce providing care? How do they articulate that what you're doing? How do they articulate what you're doing? How can they explain how these fit together? And does everyone know what these things are? So, demonstrating workforce capability, it is about showing documents that you've done certain things like workforce planning, like a strategy. But I think more than ever, it is about connecting those items to actual workforce outcomes. So triangulation, a really critical point, how does all your evidence link together? And are all people in your organization talking about what you do in a consistent way? So I guess a key message to reinforce when it comes to workforce capability is that auditors will look for both the intent, what you want to do, what you're planning to do, what you're trying to do, and the impact. Not just about what you're saying you do, but is that actually happening on the floor? Is there actual evidence to show that your workforce has the knowledge, the skills, the attitudes, and the competencies? Are they enabled to perform effectively in their role? So it's no mean feat. As I said, I do genuinely want to keep acknowledging this is a massive standard to meet, but you are already doing so many of these things, thinking about connecting those dots and aligning all levels, all people in your workforce to share what you're doing is going to be really helpful in an audit. Okay, I am going to give you a break from me for a moment and introduce Robbie Russo. Robbie Russo is our Chief Product Officer at AusMed, and he genuinely knows the regulation as well as anyone. He looks at it slightly differently to you or I would, and that's through the lens of, how do we at AusMed build products? How do we build software or tools to help make meeting these requirements even easier? So I'm going to hand over to Robbie. He is going to show you how we've taken some of these elements, these key changes within Standard 2.9, specifically human resource management, and brought it into AusMed's products. So welcome to Robbie Russo.
Thanks. Thanks, Zoe. So hi, everyone. My name's Robbie, like Zoe said. And what I'm going to run through today is AusMed Perform, a product that we've developed with a number of organisations who are already using AusMed. And our main aim with this product is really threefold. One, to make everything to do with performance easier for the administrators, the managers, and the workforce that are involved in the process. The second is to make it as easy as possible for you to meet your regulatory and compliance requirements, evidence, and the documentation around that in the event and case of an audit. And finally, to lay the foundations for that better practice. Zoe was speaking a lot about how some of us will just be trying to get to meet the minimum of the new standards, which is totally understandable right now. But in doing that, how can we support you to lay the foundation for continuous improvement and to make those processes better and better? And the real driver for this are the new action items in the regulations around 2.9.7, which is undertaking those regular assessments, monitoring, and review. And there's a bit about that around connecting it to feedback and from the individuals and peers and managers, and also connecting those reviews to training and education and how we can support our workforce to improve their capabilities. So I will take you through a very short walkthrough of AusMed Perform. I'm just going to go through both the manager and staff experience. And if you'd like more information or a more in-depth walkthrough, please feel free to reach out. So I've just shared the view for a manager. Cool, got confirmation everyone should be able to see that. And what you should see here is the AusMed Perform dashboard. The primary difference between the performance product and our learning and policies product is that we're really dependent on our managers to take action in the performance process. With learning and policies, the admin team, our head office, can really follow up with individuals to get things done. But when it comes to reviewing performance and giving feedback and making sure that the workforce on the floor are improving, we need the managers who are familiar with them, with their work, to give the appropriate feedback. So you'll see here that we can see by reporting line on the dashboard. We can also see completion rates, and we can see that broken down by which manager and staff need to do. So we've really tried to focus this on supporting all three groups. So with AusMed Perform, there are really four main actions you can take. One are the reviews, and the reviews are the cycles, the annual review cycles, the probation cycles that we set up. And these are really the driver of the system and probably the main actions that you'll be taking. Next to goals, we have the ability to set goals for staff, and particularly for our registered staff, this is really helpful because it connects to the AusMed portfolio and allows them to link their CPD to it. The next, we can give feedback to staff. So this is specifically referenced in the regulations supporting material about how feedback needs to be used to support our reviews and how we choose training. And third, we have our performance log, or fourth, sorry, we have our performance log, which is all about adding internal notes to do with the employee's performance, things around time and attendance, behavior, things like that. And finally, we have all the reporting functionality that we expect from AusMed. So I'll start with our reviews here, and I'm going to look at two that I prepared for the webinar, our annual review and our probation review. Our annual review is done based on enrolment and occurs every 12 months, and our probation cycle is a once-only cycle. So this cycle consists of 3 activities, which are totally customizable. We have templates you can use, or you can import your own. The first is the site induction checklist. So this is something we've seen a lot of. Often when an employee starts, they might need to work through, do you know where the emergency exits are? Do you have your name badge? Things like that. The next is just a 3-month check-in to see how they're going. And finally is the final probation review. So as an admin team, we set this up, we enroll the staff in, and then from there on, it's all automated. And this is really about reducing your workload, the manual follow-ups, the paper documents, everything to do with that, and also turning this into actionable data for you. So now I'm going to get into the manager and staff view. So once staff members enrolled in that, all your managers need to do is come to their task list here. So when you're talking to your managers about performance, you just need to look here. And there's really everything they need to do in the task list. So you can see here, we have the probation review, the 3-month and the site checklist all here. From here, I can also add a performance note about an employee. So let's say my webinar staff was late to a shift. I can just add in, spoke to webinar staff about being late to a shift. I can add any evidence from that. I can tag it to time and attendance, link it to any standards for reporting purposes, and tag it as positive, neutral, or constructive. So once I've added that in, it'll be linked to their profile. I can also set a goal, which will be visible to them, and in a similar way, give feedback. And this feedback will actually be sent to the employee. And we've got a lot of positive feedback about that, because sometimes the positive feedback can be siloed. The negative feedback will always hit the workforce to improve, but the positive feedback can be siloed. And the organisations that we've partnered with have found this a really effective way, once a week, every day, once a month, to give feedback to staff about, what's been going on and the kind of positive comments you've received from family and individuals. So from here, you can also, as a manager, open up these tasks, and you can see in here all of the points that you've added in. So in the checklist, we can work through, tick through all the items, add comments. I can also see how they're progressing with their learning, policies, and performance activities. So I can click in here to see how they're moving through the induction work plan. For example, I can also see any perform logs that I've added, and check all of those. So all of the information in AusMed, from the learning, from the policies and the feedback and performance notes that we've added in, kind of come here to support you and make it as easy as possible for your staff or for your managers to give feedback to staff during the performance review process, and also serve as documentation and evidence in the event of an audit. So once I'm all happy that I've done this as a manager, I can just click save and mark as complete, and that will be sent to the staff member. So I'm just going to discard those. So jump into the staff member experience here. In this case, I'm a new staff member who's just joined, and I'm going through my induction probation process. So here I can see all of the probation activities that I've been assigned, alongside my policies and my learning. And this is available both on the web app and the mobile app. So I can come in here and see this 3-month check-in that I've been working through. I can see notes. I can come back and do it later. But when I'm happy with it, I can just hit submit, and then that will be sent to my manager for review. I also have a copy saved to my profile that I can access at any time. And when my manager gives me feedback, it will appear here. I can also come through and see that I've got 3 tasks due for my probation cycle. And I can also come in advance and see that my annual review is due in 365 days. So it allows the staff member to keep all the feedback, all the goals, all the performance activities really front and center, makes it really clear what they need to do, so there's no surprises for them, and allows them to view in advance any of the questions that we might be asking them in the meeting. So I'm just going to come back through now and look at what it looks like for a manager point of view. And the main thing I want to point out for the administrators is the reporting. So we have all the same standard reporting that you'd expect from AusMed. You can see we've tried to keep this as consistent as possible to make it as easy as possible for you. You can come through here, run these reports. And when I do that, you'll see all of the activities that need to be completed. I can look at it by cycle. So if I have an annual review cycle for care workers and a different one for RNs or different probation staff, I can look at all through there. I can break it down by team, location, job role, and I can even look at it by manager. So if there's particular managers who are being overworked or overwhelmed, you'll be easily able to identify who needs that support and jump in there to make it more manageable. But yeah, that's a very, very high-level overview of AusMed Perform. If you have any feedback or you'd like some more information, please don't hesitate to reach out.
I could listen to Robbie talk about AusMed's learn, perform policies anytime. I think he's just given a really, really great, very brief tour of, how we're thinking about how do we support you. We know that there's a lot. There is genuinely a lot right now to try and get your head around. If there's, a system or a tool or something to help make that a little bit easier, then that's our job done. We're really pleased to be able to support you with that. So thank you once again, Robbie. I am going to now just touch on 2 kind of really key concepts, psychological safety and trauma-informed care. As I mentioned at the start, I do want to preface this by saying 2 weeks ago, we hosted a whole evening in the AusMed office discussing this. I've recorded an hour podcast. It's meant to be an hour. I think the actual raw footage was an hour and a half on the topic. These really are big concepts to address in a very short amount of time. And I recognize I'm talking to people leaders. You have experience, you have the answers, and you have so much that you can offer on these particular topics. I guess I want to introduce these concepts, these new requirements, psychological safety and trauma-informed care, as being like the glue that holds workforce capability together. They're not tick boxes, but they are very, very strong foundations. Why? Because psychological safety and a trauma-informed approach create conditions where staff feel safe, where staff feel supported. And when they feel safe and supported, they can grow. And that is where capability develops. So they are now explicitly referenced in the standards, and there are audit items asking how are we supporting staff wellbeing? How are we supporting them to feel psychological safe? How are they communicating for safety? So yes, we do need to meet them, but I would encourage you to think of them not as add-ons, not as things on a list that you need to do before July 1 and keep on doing, but as really great enablers. Because I think, without these foundational concepts in place, there's a lot that won't stick. There's a lot of short-term effort and hopefully some changes that will be initiated, but will they stand the test of time? Possibly not. But these two concepts are foundational because with them we can build trust, we can build engagement, and as people leaders, what comes from that? We actually get long-term impact. So why the focus on psychological safety? Well, as you all know, was not last year, 2 years ago now, April 2023, we had really quite significant amendments to Commonwealth work health and safety laws, and the new requirement was around the need for employers to address hazards and risks affecting not just workers' physical health and safety, but their psychological health. So what this meant was the first time that our work health and safety regs outlined very specific steps that we must take in order to identify and manage psychological health and safety risks. So if we think about what is a psychological risk or hazard, it relates to an aspect of work design, management, or the organisation, as well as the social context of work, so how we all interact, that have the potential to cause psychological harm. So I guess in really quite simple terms, and I don't mean to dull this down to you guys, but they're work-related factors that can affect a person's mental health and well-being. So from Safe Work Australia, some of the examples that they list: high job demands, unmanageable workloads, poor support. You've got your obvious bullying, harassment, discrimination, but poor organisational change management. That's a big one to watch right now. Yeah, there is significant organisational change management occurring. We need to be doing this in a psychological safe way. And Karen is genuinely going to look at this shortly. Poor job security, unstable working conditions, they are listed as potential psychological risks or hazards. I don't want to focus on what you have to do, right? I want to think about, what the benefits are. What does that gold standard look like? And really, when we have psychological safety present in the workforce, people feel safe. And what happens when people feel safe? They can speak up, they can learn, they can grow. But additionally, fear doesn't take over. We get more creativity, we get more openness. People aren't shut down, they're contributing. And what does that lead to? It leads to staff being accountable, staff practicing safely, communicating clearly. Everyone can take an interpersonal risk. And what that means is they feel safe enough to contribute, to give feedback, to put their hand up for something, to do something a little bit differently, to drive that improvement in practice. So that's where workforce capability develops. When every person in every role can share their concerns, we get a feedback loop. Now, we can't drive continuous improvement without feedback loops. So this principle of psychological safety, and as you'll see, closely connected with trauma-informed care, is a real enabler to workforce capability genuinely developing. As many of you will know, a trauma-informed, healing-aware approach to care is new in these standards. This might be new to some. I'm sure you've done some reading. If you've got a mental health or an acute care background, you'll know that its origins. And the origins of trauma-informed care aren't new. They actually began with a study in the 90s called the ACE study, ACE meaning Adverse Childhood Experiences or Events. And what this large-scale study found was that there was actually a really, really strong link between adverse events or childhood trauma and then going on to have major risk factors for not just mental, but physical health conditions later on in life. Cancer, diabetes, addiction, even things like fractures and burns. things that we might dismiss as minimal actually were more likely to occur if a person had one or more adverse childhood events, and they're common, right? The key point to understand the origins of trauma-informed care is that, they're common and they have a lasting impact. So a couple of other key points, about trauma is that if you think of universal precautions, we can't see trauma, so we don't know who needs to have a trauma-informed approach. Therefore, we have a blanket rule that we need to have this approach because we need to provide to everyone care and engage with people in a sensitive and respectful manner. I like to think, very, very simply, and it stood out to me as a definition I heard many years ago when talking with an educator about this, when AusMed ran conferences and seminars, was a way we can think about trauma-informed care is by not asking, what's wrong with you? Why can't you just, lose weight if you're working with someone with an addiction, a food addiction? Or why can't you just, and instead, what's happened? What's happened to this person? So as you can hear, there's so much in trauma-informed care. There are specific requirements in the standards to educate staff on a trauma-informed approach. Your staff do need training. But I guess why we're sharing this here when talking about workforce capability is that they apply to your staff too. In fact, all of us, to everyone that we work with. When we can support people and understand that what they're bringing, what I'm bringing, what you're bringing to work each day, our experiences, what's happened to us actually shapes who we are. When we acknowledge that, we're enabling that safety, that psychological safety. We're enabling everyone to take those interpersonal risks, to speak up. We're creating those feedback loops and creating that culture where actual psychological safety is present, and we can therefore build workforce capability. I'm actually going to skip over some of this. There is a very good article that we'll publish on embedding trauma-informed care, but a way to very, very simply think about, okay, how do I take this concept and make sure, my organisation, my people are supported to understand this and to grow and learn about this concept. There are 6 core principles. Safety. Is there psychological and physical safety in your organisation? Trustworthiness and transparency, just thinking about open disclosure. That's where this fits in. So you'll hear things that you're already doing. Remember that triangulation? It is about linking and aligning, connecting those dots from what you're being told you have to do in these new regulations and actually what you're already doing. Next core principle is peer support. Value lived experience, which I'm sure many of you are, but not just in the people that you're caring for, but within your team as well. Doing a training session, how do you add some lived experience into that story? Collaboration, all right? Simple, are you at eye level? How are we talking and how is our body language reflected in a really collaborative approach? Empowerment, I'm sure you all do this. I'm sure you acknowledge those wins. I'm sure your people leaders, your cheerleaders. How do we recognize, people's growth and impact? And finally, humility and responsiveness. And I think, this is the hardest one because it starts with us, doesn't it? It is recognizing that we actually all bring personal biases. But if we as leaders stay open to learning and growing without judgment, digging deep to find that compassion, even when we work with challenging people and challenging situations, then that is bringing a trauma-informed approach, and that is what will create psychological safety in your workforce. So genuinely, we have touched on, just the tip of the iceberg of some really key concepts. I'll really encourage you to check out the AusMed Toolbox. You can subscribe to get a weekly email. I send it out. I promise I won't spam you. I really try and put some really relevant resources in, and you'll see, workforce capability starts in the boardroom. Beautiful article Karen's just about to publish. How to minimize burnout, thinking about as people leaders, what do we need to do? Yes, for ourselves, but also our people. There's some really, really great resources there. So I encourage you to check it out. All right, I am going to hand over now to Karen Patterson. Karen's previous role was phenomenal. What she brought to AusMed was many years' experience as Director of Capability and Culture at New South Wales Health, specifically in the Clinical Excellence Commission. So I can actually hand on heart say she does know a thing or two about building workforce capability and really critically leading, guiding, and bringing people through change. So I'm going to hand over to you, Karen. Take it away.
Fantastic. And I think I need to take Zoe with me everywhere. She and I saw people saying there in the chat there about how calm and positive she is, and it is such a great experience for me to be able to work with the people of Zoe's ilk, but also the amazing work. And I would 1,000% encourage people to check out the AusMed Perform. In my previous roles, having access to data and being able to visualize and engage and make it accessible and transparent just makes the world of difference. So thank you for the opportunity again. And it's lovely being the third webinar to be here today again. So just starting off, so you're doing the slides. Great. Thanks, Zoe. So my sort of quote here that Zoe has captured, so thank you. But basically, I suppose it's just about reinforcing, which is about your people are your organisation. It would not exist without them. So if your goal is to deliver respectful, safe, reliable, person-centred care, aged care in partnership with individuals and their families and supports, you really need to know your people and your culture. Think of capability as your staff's practical ability, knowledge, skills, attitudes, and confidence to apply learning safely and effectively in real-world situations, even when under pressure or facing change. So capability, as we've talked about before, is not just education. It's real-world skills application. It's confidence, competence, consistency. It's demonstratable, so it's observable. It's a behaviour. It's organisational-wide, and it sustains. It sustains change. And it's the difference between attending a training session and being able to translate that training into effective action when it really matters, when things change. Given the complexities of aged care, your workforce capability must reflect your organisation's unique context, your risks, your resources, and your values, which reinforces Zoe's earlier comment about a standard is a guide, provides the guideline from there, but its application needs to be unique into your context and using your context to achieve that standard. So capability building needs to be strategic and practical, ensuring your approach is both evidence-based and relevant to your daily operations. So why does capability matter? Simply because it matters to the individuals who receive your care. They expect and deserve a capable workforce, supported and enabled by a capable organisation. You will be familiar with this expectation statement, and it isn't just a standard. It's the fundamental reason behind the changes you're making. It is your driving force. So when your workforce feels supported, skilled, and capable, they deliver better care, and older people experience improved outcomes. That's the mantra. That's the win-win. So to make and drive local changes required for consistently implementing the strengthened standards across the aged care services, it helps to follow, well, my bias is, it helps to follow a clear, logical framework. So you may be familiar with Kotter's 8 steps for leading and accelerating change. So an evolution has been Kotter's principles for powering change. You'll notice they're framed as dual operating systems, for example, select few and diverse many. So Kotter's 4 principles of change focus on co-creating the conditions for people to engage in and with change, and we'll provide some links. The change principles reflect the mindsets, attitudes, and behaviours. Sound familiar? It's the capability needed to power, spread, and sustain change, rather than focusing on structures and processes of change. So what I've done is put this into practice for workforce capability building. So using Kotter's change principles as a practical roadmap. So for example, if you start with the first step about clarifying your vision and using the principle of head and heart. So if you clearly communicate why workforce capability matters, speak to the head, the rational, and the heart, the emotional of your staff. Relate directly back to the Standard 2 expectation statement. Your workforce capability is the pathway to older people feeling genuinely cared for, respected, and safe. Step 2, form your coalition. Select few and diverse many. Engage a focus team. You've got to get the work done. Leaders, managers, influential staff to champion capability building initiatives. And plus, involve a broader group of stakeholders, frontline workers, older people, carers, to ensure diverse input and authentic participation. Being involved in the change, contributing to the change, makes it more likely that the change will happen in practice. Step 3, plan strategically. Management and leadership. Balance clear management processes, such as your training plans, documentation, competency checks, with visionary leadership, psychological safety, trauma-informed culture, open communication. Clearly link your plans back to the outcomes. For example, we're focusing today on outcome 2.8 on workforce planning and 2.9 on HR management. Finally, making it meaningful. Have to and want to. Demonstrate clearly that capability building isn't just compliance. Show your workforce that capability initiatives support their personal growth, career progression, and day-to-day satisfaction in their roles, creating a positive work culture. So that's how we can combine Kotter's 4 principles of change and utilize that to engage in capability building. So next we'll go to visualizing change. So this is a helpful tool for sharing in readiness for audits, and that you can use to share updates and get feedback from all stakeholders to clearly demonstrate your workforce capability journey. So using a simplified program logic model, which I'm sure you're familiar with. So it's a clear visual that helps you, your people, your organization, or holder people understand how daily actions link directly to improved care outcomes without overwhelming with visual detail. So again, we've provided a simplified example using the logic model to clearly illustrate the theory of change, linking your resources and actions to desired outcomes. So here's a practical, clearly structured program logic example for Standard 2, Outcomes 2.8, Workforce Planning, and 2.9, Human Resource Management. As you can see, it's high level, it's visual, it's on a page, which is a helpful resource for communicating with your client, with your residents, clients, individuals that you care for, with your staff, and within your organization. It can go from the board down to the people on the floor. So under the headings of inputs and resources, for example, as we've got there, that's your workforce documents. Your activities would be a skill gap analysis. Your output would be a workforce plan that clearly articulates expected competencies. And your outcome is your staff are confident and competent. Looking at a learning management system or capability tracking system and clear governance processes, similar as we said to AusMed Perform. So capability monitoring and tracking is the activity. Your outputs are real-time workforce data that can actually generate reports that are, again, from the board down to the bedside. And also increased awareness of and the outcome from that is increased awareness of progress, risks, and opportunities for innovation. So I'd encourage you to have a look at ways that you can organise your your theory of change, of how you're going to progress your capability building strategy, and utilising a one-page program logic model can make that accessible and also support your audit processes. So just moving on to some immediate practical actions to strengthen your workforce capability. So the first one I've got there is about evaluating existing systems and identifying areas for improvement. So this has been reinforced throughout. So identifying and clearly documenting your current capability gaps, including feedback from staff and care recipients. So that's your ground zero. So that's the part which is about knowing your people and knowing your context and knowing the expectations from there. So clearly share your vision across your organisation. Again, this is where the program logic could be an easy way to visualise your vision and create a bit of a roadmap that links your actions and outputs to impact, and being able to provide some measures that match with that. Start small, pilot, and then scale up. So immediately implement structured competency checks or daily huddles, then scale what works in your context for your people, what makes a difference, and scale that across your organisation. In a process, working with a human system, that needs to be adaptable to different circumstances and contexts. But when you're looking at scale, it is about taking the principles and applying them in different contexts. So ensure psychological safety is a cornerstone of your workforce culture. So the most significant impact on how people feel in the workplace, whether they will speak up, whether they will engage in learning, whether they will contribute to improvements, is related to their sense of psychological safety, the ability for them to take interpersonal risks, the ability for them to provide feedback, provide critical information that you need for your capability building. Finally, engaging your board with clear and regular updates and evidence. So establishing regular structured board meetings to review workforce capability data, outcomes and strategies. Again, I'm never into replicating data from there. So if you've got a process, if you've got your visual through your program logic, you can use that as part of your board report, and then you can have a data report that sits below that that shows your progress against your measures of success. So in summary, for key messages, just to remember that the strengthened standards are more than accreditation. They offer you a powerful opportunity to build a capable, confident and caring workforce. So clearly aligning capability building efforts with the standard 2 expectation statement, which is what matters to the people that you care for, and using logical, practical steps to drive change effectively will deliver you outcomes beyond achieving the strengthening standards to improving the performance and productivity and well-being of your staff and improved outcomes for the people that you care for. So thank you, Zoe.
Thank you, Karen. Gosh, I need a couple of minutes. I can't just sum Karen up and go to the next slide. I just need a couple of minutes myself just to think, oh, isn't that a breath of fresh air? And, you know, I genuinely, you know, I know you can, these things, I know you've heard them, but you've heard them from people that have genuinely done this. You know, what Karen has shared with us are things that work. And you can take this and you can bit by bit put these things into your workplace. You know, I'm sure that everyone here has worked at a place or is at a place where we genuinely feel that safety, where we feel that inspiration, where we feel that enablement. You know, so this is a really good reminder that these things, they're not just concepts, they're not just words, they are real things. And this is what gives us joy. This is what makes us want to show up to work, to contribute. So yes, they're needed. Yes, they're in the standards, but this is also, what gets us out of bed every day. So thank you so much, Karen. I love and appreciate your words of wisdom, but also, balanced with very, very practical models and examples that we can take away. I particularly love, ordering. My brain, puts things in boxes. How you can think about, all right, so my input into the system is my workforce strategy. The activity is your workforce planning, and then bit by bit you can see how it all connects together. All right, so that was our webinar for today. I know we're at time, so I am going to very, very quickly end with just a couple of housekeeping sort of key messages. And that's it. We just wanted to highlight, Karen and I saw this email come through, I think it was late last week, that it's not just us talking about workforce capability at the moment. It is really a national focus, and there's some great funding opportunities available at the moment. It's the Aged Care Collaborative flagship project. It's funded by the Department of Health, but it's through ARIA. So I'm sure you've all heard of ARIA. And it's supporting organisations to co-design and then implement practical workforce interventions. There's 2 projects, and there's up to $120,000 in funding per site if you are successful to help work on these projects that really are looking at driving workforce capability. So there's the link. We can also put it in the chat for anyone that wants more information. And the good news is that we're halfway there. We have these 6 webinars that are designed to support you up until July 1 and beyond, of course. I hope that you've all got some time off over the next couple of weeks. There's lots of public holidays. Make the most of it. Reset, take some time to really gather and pat yourselves on the back. You're doing a phenomenal job. This is an exceptionally challenging and at times overwhelming period. So take a break, take a pause. I hope you get some time off work, enjoy it with your friends and family, and enjoy the chocolate, of course. And we hope to see you at our next webinar, which is going to be fabulous. We're going to do more of a panel conversation, Q&A, that is looking at what best practices in competency-based education and assessment are. So thank you for attending today, and we look forward to seeing you after the Easter break in May for our next webinar. Take care, and thanks for joining us once again.